Black History Month comes with an inspiring and unfinished legacy. It is a place to gather and remember. It is a call to recognize and to act. In the context of healthcare, it can be an opportunity to draw attention to important contributions from Black people in medicine. It can also be a way to acknowledge the racial disparities that exist in healthcare and devise and implement ways to close the gap. Michael Burson is a senior social worker at the Sanford Roger Maris Cancer Center in Fargo, North Dakota, who has witnessed racism and experienced it personally. He knows the history too, and has seen its resilience and strength.
Black History Month, for me, is an opportunity to celebrate the incredible achievements of Black people in America. So when I think about disparities in healthcare, I think about the different policies and the laws and the ways that Black people were treated in the history of our country.
That history includes notorious examples of Black mistreatment in healthcare. Burson cited what are now infamously referred to as Mississippi appendectomies. It involved the practice in the South of sterilizing Black women against their will, and it persisted into the 1970s.
It's easy to understand why people wouldn't necessarily want to come see their doctor when that type of stuff is going on. Now, this is absolutely not a one-off instance. We've got many instances of this happening throughout our country.
As a healthcare system serving much of the upper Midwest, Sanford Health has identified closing minority healthcare disparities as a priority. According to the U.S. Department of Health and Human Services Office of Minority Health, African Americans have the highest mortality rate for all cancers combined compared with any other racial and ethnic group. In addition, the CDC reports that the infant mortality rate among Black Americans is almost twice the national average.
We can't address what we don't acknowledge. So illuminating healthcare disparities is one way that we're empowering our staff to meet the unique needs of our community. We're uniquely equipped to be training our employees to be responsive to that so that our community feels like we're an inclusive and affirming health environment, and that can impact clinical outcomes. If we are providing an inclusive and affirming environment as a healthcare provider, what that will do is it will break down those barriers of bias and communication and trust, and it's going to allow our community in our doors.
Sanford is also making a concerted effort in its hiring practices. It is another way to add impact to Black History Month.
We want people to know that when you come to work for Sanford Health, you can bring your whole self to work. You'll be valued and celebrated for exactly who you are.
Burson, who has been serving as a social worker at Sanford for more than 3 years, can identify with the challenges brought about by being a person of color. Burson suffers from migraines occasionally, and in one instance in Denver while out with his wife, he began to suffer what is called a hemiplegic migraine. His optic nerve was inflamed, and as a result he could no longer move his right eye. He was terrified. He thought he was having a stroke or was suffering from a brain tumor. Thinking the worst, he went directly to the emergency room.
I was questioned heavily for over a half hour in the midst of a medical crisis about all the drugs I was using. At the time, I was in graduate school, and I actually worked at the hospital as an intern for my master's. So they couldn't see that I was a graduate student having a medical crisis. They thought I was using drugs. And I was questioned multiple times about my drug use, and that made me feel like maybe I wasn't going to be taken care of, and maybe they weren't going to believe me, and maybe they were going to do something to me that wasn't necessary. So I was very scared about that, and it still impacts me today, and it informs the way that I look at healthcare now.
It was a precise example of the kind of provider-patient interaction to avoid in healthcare. It didn't take place in a Sanford hospital, but as Burson can attest, solving a complex problem goes well beyond finding someone to blame.
I am very proud to work at Sanford Health and to be a part of the efforts in adjusting this level of thinking. I would never dream of holding anyone today, responsible for the histories and experiences of Black people in the past. I would not want to do that. However, I think people 300 years from now will hold us accountable for the way that we dealt with the information that we have now. So it's important that we get this right, because I think the future will judge us.
For Mick Gary, I'm Jason Anschutz, Sanford Health News.